Welcome back, and news is coming through from Maharashtra, where the indication is that there will be no relaxations or lifting of the lockdown as per the Health Minister Rajesh Tope. But although they said that there will be some relaxations that will be allowed, but lockdown will not be entirely lifted, and that still remains some concerns. But most importantly, he's indicated that there is a new variant in Maharashtra which is quite virulent, and there is a certain level of positivity which is concerning. Let's listen into the Maharashtra Health Minister.
इसीलिए ज़रूर जिन ज़िलों में डिक्लाइन है उसमें जो शिथिलता दी जाएगी उसके बारे में प्रॉपरली डिसीजन, उसके जो भी डिटेलिंग है वो 2 दिन में 1 तारीख तक निश्चित तौर पर उसका वितरण किया जाएगा।
अभी भी कामयाबी नहीं मिली है। 10 दिन में 9,000 से भी ज्यादा लोगों की मौत हुई है। संक्रमण भले ही कम हुआ होगा, लेकिन मौत का आंकड़ा
यहाँ जो CFR है निश्चित तौर पर थोड़ा बड़ा है। इसकी वजह यह जो वायरस है इसमें वेरिएंट भी नज़र आ रहा है। ऐसा ही रिपोर्ट हमारे पास है कि वेरिएंट है और इसलिए अलग तरीके का बर्ताव वायरस से हो रहा है और इसलिए भी थोड़ा संक्रमण भी बढ़ रहा है और उसमें मृत्यु दर भी थोड़ा निश्चित तौर पर अगर अर्ली डिटेक्शन नहीं हुआ तो दिखाई दे रहा है। तो इसीलिए अर्ली डिटेक्शन के लिए या हर किसी को भी अगर सिम्टम्स आते हैं तो मैं यहाँ अपील करना चाहूँगा कि कोई भी व्यक्ति ने नज़दीक के जो डॉक्टर होते हैं, जो जनरल प्रैक्टिशनर्स हैं, उनको न दिखाते हुए इमीडिएटली टेस्ट करवाना ज़रूरी है और टेस्ट पॉजिटिव है तो कोविड हॉस्पिटल में भर्ती होना बहुत ज़रूरी है, क्योंकि अगर लेट प्रेजेंटेशन हुआ तो फिर तुम्हारा जो HRC.
So Rajesh Tope, they're saying that it is the variant which is more virulent, and perhaps that is spreading, and that's the reason why there is a higher CFR or case fatality rate. 9,000 deaths in the last 10 days in Maharashtra itself, even though there is a big drop in the positivity rate and also the overall caseload. Vinaya Deshpande now joining us. Vinaya, at least about 20 or 21 districts which still remain a cause for concern. Is he talking about, Rajesh Tope talking about a new variant, or is he talking about the B1.617.2, which is the more virulent strain and its presence more in Maharashtra?
Yes, he is talking about the same strain that is virulent, and that is the cause of concern for Maharashtra. Now remember, the state government was mulling over whether lockdown can be lifted in the entire state, but now the Home Minister says complete no for lifting of lockdown in the entire state. In fact, he says 21 of the 36 districts have high positivity rate, which means lockdown in all these districts will continue. In the other districts, relaxations will be given depending on the positivity rate and depending on whether the state is in green zone or not. But as of now, the government completely denying any possibility of lifting of lockdown in Maharashtra by the 1st of June, saying that the case load that we have right now, Maharashtra continues to report over 20,000 cases, which was the highest in the first wave. And now in the second wave, from the highest, we have somehow plateaued on 22,000. But the state government feels the numbers need to come down further for any relaxations to be given across the state, Anand.
Yes, then the fatality remains a concern because of the 311,000 deaths across the country. 90,300 plus deaths have happened only in Maharashtra, and which is something which even Mr. Rajesh Tope has acknowledged, that there is a higher CFR or case fatality rate in Maharashtra at the moment. Thank you for your inputs, Vinaya. Moving on to more news coming through, and this time it is the Twitter face-off with the government, where the Delhi police has now taken on the social media platform Twitter, saying the social media giant statements are designed to impede a lawful inquiry by a private enterprise. The police is saying that Twitter is purporting to be both an investigating authority as well as an adjudicating judicial authority and has no legal sanction to be either. We go across to our political editor, Maria Shakil, for more. Maria, this is in response to Twitter's statement earlier in the day, where they claimed that the actions by the Delhi police were intimidation tactics.
Yes. Now, the Delhi police has issued an elaborate statement in which they are making 3 points here, Anand. First, that the Delhi police has registered a preliminary inquiry at the instance of a complaint that was filed by the Congress party, and hence the efforts by the Twitter that portrays that this is an FIR filed at the behest of the government of India is wholly and completely wrong. Second, they are saying that while the investigation was on, Twitter, while placing the cart before the horse, went ahead and declared that the toolkit was manipulated media, which means that Twitter is in know of certain facts which the law enforcement agencies must be provided with. What they are saying is that Twitter was asked by way of multiple communications to join the inquiry to provide the information that it possesses. Third point being made by the Delhi police is that the purpose of Twitter being served a notice to participate in the inquiry was to allow the investigation to proceed in a direction that will bring the relevant matter on record. And Twitter India's subsidiary, that is the TCIPL's managing director, in fact chose to adopt a path of evasiveness instead of cooperation. What they are maintaining clearly is also this, Kanan, that this is a contrived fear-mongering that is being done by Twitter, and the managing director of TCPIL was merely served a notice, not as an accused, but to participate in the inquiry, as Twitter claims to have been acquainted with certain facts.
Well, a company's policy cannot become the rule of law, and a company cannot become the investigating authority and the judiciary or the adjudicating authority. We have the courts and the police to do that job, and that's what Delhi police is trying to remind Twitter, saying you are asked to cooperate. Now you're not being questioned as an accused. So there is a difference between the two. So don't try and play this intimidation game, and don't try and create a deliberate misinformation or a deliberate perception which is false and not based on valid ground. That's the counter that's come from the Delhi police. Maria, thank you for your inputs. Moving on here on the Nation at 5 to another important aspect across the country. Ladies and gentlemen, we need to get vaccinated, and the government is now coming out and saying there will be more jabs available very, very soon. So it's time to go out and get that shot of life, that is the Sanjeevani, and also encourage others to do it, because vaccine hesitancy is a problem. We are the only nation after the United States to cross the 20 crore vaccination mark, and we have done it faster than the US. Ever since we started the vaccination drive in January, in just about 140 days, we have been able to cross the 20 crore mark. No mean achievement for us as a nation, and we should be proud of it, although the vaccination rate can be much better. Over 18 lakh people were inoculated in the last 24 hours, despite states having close to 1.7 crore doses with them. So clearly this rate of vaccination can be much better than 1.8 million per day. While 1.5 lakh people have been administered the second dose, 17 lakh beneficiaries received their first dose of the COVID vaccine. This is what Dr. V.K. Paul had to say.
A very major effort will now be made to further streamline the coordination along the three channels of supply, and certainly the vaccination pace should pick up, and going forward to July we have a total of 51.6 crore doses. A large proportion of that's available, and that has to be used in an efficient manner, even as we build our efforts to increase the stockpile. Steady progress is being made, and we are also reaching out to international manufacturers, in particular Pfizer, for making vaccine available now that they have shown interest.
So the jab availability is going to be further ramped up to about 51.6 crore doses by July. So at least 20 to 30 crore doses should be available between now and July itself. That's the indication by Dr. V.K. Paul. So more states need to reduce vaccine wastage, and increase the rate of vaccination, with the government now saying vaccines will be available soon. Meanwhile, the Apollo Group of Hospitals has put out a statement saying it has completed 1 million vaccines across 80 locations in India. Priority has been given to frontline workers, high-risk population and corporate employees across the country. The Apollo Group of Hospitals has said that it will further ramp up its immunization program after achieving the first million jabs in 3 weeks. It plans to do 1 million jabs every week in June and double that rate in July. The hospital is saying it's on track to complete 20 million jabs by September 2021, where after Covishield and Covaxin, Sputnik V will be available through the Apollo system from the second week of June. But while urban Indians are flocking to the vaccine centers, grassroots health workers in rural areas are continuing to face a wave of vaccine hesitancy. In rural Maharashtra, for example, in villages near Palghar, frontline workers are facing an uphill task in urging villagers to get inoculated, educating them on the benefits of vaccination. It's also one of the prime focus areas of CNN News 18 and Federal Bank's initiative Sanjeevani, with Apollo 24/7 as our partners and NGO United Way Mumbai driving the awareness program on ground. The workers facing ridicule, rejection amid rumors of vaccines causing impotency, and worse, despite extensive counseling, awareness and information drives, many coming out to say they don't want to get vaccinated because they believe that if they get vaccinated, they will die in a month.
मैं इस वक्त मौजूद हूं पालघर जिले में, जहां पर यह जानकारी सामने आ रही है कि बड़ी संख्या में जो लोग हैं वो वैक्सीन लेने से घबरा रहे हैं। वजह यह कि उन्हें इनके मन में यह डर है कि इस वैक्सीन से न सिर्फ फीवर आता है बल्कि 1 महीने में मौत हो जाती है। यहाँ पर जो वैक्सीनेशन केंद्र है, क्या अभी तक जो आदिवासी लोग हैं क्या आते दिखे हैं? बहुत कम लोग।
एक भी हमारे गांव में, मैं खुद रहता है, हमारे गांव में एक भी ऐसा आदमी नहीं आया क्या खुद वैक्सीन ले ले, कोई भी नहीं आया।
कितने गांव में कितने लोग अब तक वैक्सीन आपके ले चुके हैं, कितने बाकी हैं?
बहुत सारा गांव तो वैक्सीन लिया ही नहीं, उसमें
लिया ही नहीं है। तो आसपास के गांव में भी यही हाल है?
हाँ, आसपास का ही सबका ही हाल है।
यहाँ पर फिलहाल जहाँ पर वैक्सीनेशन केंद्र है, वान गांव के सरकारी अस्पताल में यहाँ पर सन्नाटा है, और जैसे कि यहाँ के वार्ड बॉय के तौर पर काम करने वाले और एक गांव के उप सरपंच भी हैं, उनका यह कहना है कि लोगों के मन में यह डर है कि वैक्सीन लेने से बुखार आएगा और फिर 1 महीने में मौत हो जाएगी।
Anil Parmar, Vice President, United Way Mumbai, is with us. Anil, you're doing a phenomenal job across more than 500 villages. The task for you and your team is to spread vaccine awareness. But look, not so far away from Mumbai, just about an hour and a half or 2 hours drive, villages are not turning up to the vaccine centers because an entire village believes that if they get the jab, they will die in 30 days. Now, there is a similar instance which comes from Madhya Pradesh in Jabalpur, where women have actually blocked healthcare workers from entering the village, and they are all standing there and saying nobody's going to get vaccinated.
True, Anand, and that speaks, that really shows the kind of vaccine hesitancy that prevails in the rural India. There was a case recently in Barabanki in Uttar Pradesh where villagers chased away the healthcare workers, and they ran into the pond to just run away from the healthcare workers to just prevent themselves from getting inoculated. So the intensity of vaccine hesitancy is much larger in rural parts, especially when we go into tribal areas as well. And this is something that needs to be broken. Yeah. And that's what we are working for in the Sanjeevani campaign as well.
But how do you do that? Because largely a lot of them are Adivasis who are actually turning out and saying, no, we don't want to get the jab. We are not getting it. How do you break through these kind of misconceptions and false perceptions which they have? They're saying even the elders in the family, they will not get them vaccinated. Ye ho jayega, wo ho jayega. Multiple reasons are being given.
True, Anand. So there are 3 aspects that we try and cover when we do awareness sessions or sensitization sessions. And this is true for government machineries as well. One is the knowledge, second is attitude, and third is practice. The correct knowledge, it needs to be passed on in local language, in local, through cultural perspectives as well. And we have to keep in mind that the message that we give, the words that we try and use when we talk in rural parts or tribal areas, it's something which is relevant and will easily resonate with the communities that we are talking to. So that particular strategy needs to be adopted, and that's how we can pass on correct knowledge about vaccination. More often than not, what we do is we jump a step and say, please get vaccinated. This is the importance of vaccination. But probably sometimes it's important to start talking about what vaccination is. Tika hota kya hai is something that we need to start talking about first, and then move on to telling them the importance of vaccination. It's also important to tell them how it works in the body. What is it actually? There are two drops. There are some drops that are in the vial of the vaccines. What do they mean? What are they? And that's something that we try and explain in local languages. Try and explain in the words that which are easy to understand and not go into a lot of medical terminology as well. Once we do this, once we try and improve correct knowledge, this really leads to correct attitudes towards the inoculation drive that is happening as well. And that can in turn work towards practice, which is getting themselves inoculated through the vaccination centers.
Yeah, and somewhere I think we need to have live case studies where people say, I am alive, मैं बच गया क्योंकि मैंने टीका लगाया. Because right now the issue is people think मैं टीका लगाऊंगा तो मर जाऊंगा या मर जाऊंगी. We have to actually go down and tell them टीका लगाओगे तो ही बचोगे.
बिल्कुल. Because that's what कि टीका लगाने से ही सारी जो चीजें अभी चल रही है पैंडेमिक की वजह से, that will get normalized. It will we will go back to some semblance of normalcy just only if we have vaccinations going on and people getting inoculated. Here, the key influencers in the villages play a vital role. Influencers like Gram Panchayat members, Anganwadi Sevikas, who are unsung, heroes of this campaign, Asha workers in the village, they are from the community. If you and I go and talk in a village, we are essentially external people. They may not necessarily trust us with the information, but there are Asha workers, Anganwadi workers, government, Gram Panchayat members. These are the key influences in the village. We need to tap them, train them as peer health educators, get them onboarded in this campaign, let them pass on the message on vaccination in the villages. There will be more receptivity when they start talking in the communities.
True, absolutely. So the task is cut out. We know how to do it. It's just that we've got to do it aggressively, and that's what we are doing. Thank you very much, Anil. To you and to your team, kudos. Continue doing the good job, good work, and we will continue to push on with this campaign for vaccine awareness that is Sanjeevani.
Thank you so much, Anil.
Now this entire fight, why we are working out of homes, why we have had to look at lockdowns, why we have to look at vaccines and drugs and solutions is because the virus was unleashed. It was allowed to spread across the world. It is a lab leak. But now, perhaps those who had allowed this and who did this should be brought to book and made accountable. One of the biggest steps that's been taken has been taken by US President Joe Biden, who's directed the US intelligence community to redouble their efforts in investigating the origins of the pandemic and report back in 90 days. The announcement comes after a US Intel report found several researchers at China's Wuhan Institute of Virology they fell ill in November 2019 and had to be hospitalized, a new detail that fueled fresh public pressure on Joe Biden to delve deeper into the origin of COVID-19. Experts are currently divided between deciding on whether the origins of this virus was from animals at the Wuhan wet market or actually a lab leak from the Wuhan Institute of Virology. So how do we make the coup poll of the day? Take the poll and tell us what you think. US COVID origin probe. Is this the turning point against the CCP and the CCP unleashed virus? 87% believe yes. Hashtag is probe COVID origin. The platform is coup, and the handle where you can visit, join us on the debate and also take the poll is at News18 or at Anchor Anand. On that note, we're going to take a very short break here on The Nation at 5. Stay with us.